Welcome to the MRCSBites session on Upper Limb Anatomy and Pathology, OSCE Station 1. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit MRCSBites.com. Question 1. What is the innervation of the pectoralis major muscle? The pectoralis major muscle is innervated by the medial and lateral pectoral nerves. Specifically, medial pectoral nerve. It primarily innervates the sternocostal head of the pectoralis major. Lateral pectoral nerve. It primarily innervates the clavicular head of the pectoralis major. Question 2. What is the origin and insertion of pectoralis minor muscle? Origin. It originates from the anterior surfaces of the third, fourth, and fifth ribs near the costal cartilages. Insertion. It inserts onto the coracoid process of the scapula. Question 3. What is the innervation of the pectoralis minor muscle? The pectoralis minor muscle is innervated by the medial pectoral nerve. This nerve branches from the medial cord of the brachial plexus and provides motor innervation to the pectoralis minor muscle. Question 4. Which nerve supplies the serratus anterior and where does it lie? The serratus anterior muscle is supplied by the long thoracic nerve. This nerve originates from the roots of the C5, C6, and C7 spinal nerves and travels down the side of the thorax. The long thoracic nerve lies superficially along the lateral chest wall, running between the ribs and the serratus anterior muscle. It is vulnerable to injury due to its superficial course, which can lead to a condition known as winged scapula if damaged. Question 5. What is the nerve supply to the teres major and minor muscles? The nerve supply to the teres major and teres minor muscles is as follows. Teres major. It is innervated by the lower subscapular nerve, which originates from the posterior cord of the brachial plexus, C5, C6. Teres minor. It is innervated by the axillary nerve, which also arises from the posterior cord of the brachial plexus, C5, C6. Question 6. Name the muscles that attach to the coracoid process. The coracoid process of the scapula serves as an attachment point for several muscles. Pectoralis minor, coracobrachialis, short head of the biceps brachii. Question 7. Name the muscles that make up the rotator cuff. The rotator cuff is composed of 4 muscles that stabilize and move the shoulder joint. These muscles are supraspinatus. Located above the spine of the scapula, it helps with shoulder abduction. Infraspinatus. Located below the spine of the scapula, it assists in external rotation of the shoulder. Teres minor. Positioned just below the infraspinatus, it also aids in external rotation of the shoulder. Subscapularis. Found on the anterior surface of the scapula, it helps with internal rotation of the shoulder. Question 8. Where do the rotator cuff muscles attach? The rotator cuff muscles attach at specific locations on the humerus and the scapula. Supraspinatus. Attaches to the greater tubercle of the humerus. Its tendon passes under the acromion. Infraspinatus. Also attaches to the greater tubercle of the humerus, just below the supraspinatus. Teres minor. Attaches to the greater tubercle of the humerus, below the infraspinatus. Subscapularis. Attaches to the lesser tubercle of the humerus. Question 9. What are the innervations of the rotator cuff muscles? Supraspinatus. Innervated by the suprascapular nerve, C5, C6, which branches from the superior trunk of the brachial plexus. Infraspinatus. Also innervated by the suprascapular nerve, C5, C6. Teres minor. Innervated by the axillary nerve, C5, C6, which branches from the posterior cord of the brachial plexus. Subscapularis. Innervated by the upper and lower subscapular nerves, C5, C6, which branch from the posterior cord of the brachial plexus. Question 10. Which muscles are responsible for abduction of the shoulder? Supraspinatus initiates the first 15-30 degrees of shoulder abduction. It is part of the rotator cuff group. Deltoid takes over after the initial phase, and is the main muscle responsible for shoulder abduction from about 30 degrees to 90 degrees. It has three distinct parts, anterior, middle, and posterior, that also contribute to other shoulder movements.